FSM for longevity. Using frequency-specific microcurrent to prolong health span by neutralizing inflammation. Many people are using FSM to treat disabling conditions like chronic pain, chronic infections, and chronic immune dysfunction, gastrointestinal problems, and so on. And this is great, but we fail to recognize FSM's value in terms of preventing illness. FSM is a potentially powerful tool to prolong health and lifespan. And one way FSM can help us to prolong our health span is to use it to treat what is called inflammation. What is inflammation? Inflammation is more of a mechanism than an illness. The term is used to describe the slow, long-term increase in inflammation that tends to develop in the body as people get older. Unlike a short burst of inflammation that helps the body heal from an injury or infection, inflammation is the low-level, persistent, inflammatory process that quietly stresses tissues and organs over many years. This ongoing inflammation can gradually damage cells, blood vessels, organs, and thereby increase the risk of many age-related health problems, such as heart disease, diabetes, arthritis, memory decline, and general frailty. And because of this, inflammation is considered one of the key biological processes that can shorten health span, which is the number of years a person remains healthy and active. Rusting is a good analogy for inflammation. Inflammation is often described as the body rusting from within. There are many things that can accelerate inflammation or chronic low-grade inflammation. You see just some of these on the left side of this slide. Gut dysbiosis, the American diet, stress, smoking, obesity, toxins. Then on the right side are the conditions that result from chronic inflammation: cardiovascular disease, type 2 diabetes, cancer, neurodegenerative diseases, sarcopenia or loss of muscle mass, and depression. And these are just some of the conditions caused by chronic inflammation. All of these instigators of chronic inflammation have one thing in common. What they have in common is a group of chemicals that our body secretes, which in turn causes the inflammation. This group of chemicals are called inflammatory cytokines. There are a number of inflammatory cytokines involved in the process of inflammation, but researchers agree that there are three main ones. These are called IL-1 beta, IL-6, and TNF-alpha. So regardless of the instigating factor, whether it's dysbiosis, the American diet, stress, smoking, etc., the body responds by releasing chemicals called inflammatory cytokines, like IL-1 beta, IL-6, and TNF-alpha, and that results in a state of chronic inflammation. And this chronic inflammation leads to the development of all of these health conditions on the right. What if we could lower the levels of inflammatory messengers? That would lower the level of chronic inflammation, which would in turn decrease the risk of all of these health conditions on the right side. This is where we have some good news. We can do this with a specific pair of FSM frequencies. Here's a research study that demonstrated the lowering of IL-1, IL-6, TNF-alpha, and one additional inflammatory cytokine called substance P. This study was done on 54 patients with a history of cervical trauma who suffered from fibromyalgia. They each received a series of 3 to 8 90-minute FSM treatments using a single frequency pair, 40 and 10. Within the FSM discipline, 40 is the frequency that lowers inflammation, and 10 is the frequency for the spinal cord. A subgroup of the patients also had the level of IL-1, IL-6, TNF-alpha, and substance P measured through blood samples before and after each FSM treatment. On this slide are two graphs showing the drop in IL-1 and IL-6, interleukin-1 and interleukin-6, after each treatment. And what you see is the progressive sustained drop of the cytokines between treatments. Basically, this is showing that these inflammatory chemicals kept getting lower and stayed lower over the course of the treatments. These are the results for TNF-alpha and for the VAS pain score. Remember that TNF-alpha was one of the big three inflammatory cytokines involved in inflammaging. On the left, you see TNF-alpha dropping after each FSM treatment. This was with 40-10 for 90 minutes. And on the right is the amount of pain the patients rated themselves to be in. The amount of pain dropped with each treatment and tended to progressively drop over the series of the three treatments that are shown. In terms of inflammaging, what I'm suggesting is that you can lower the impact of inflammaging on your health by simply running the 40-10 FSM protocol regularly. So you would run an FSM protocol that has 40-10 in it, and here are some of the protocols: 40-10 alternating current, 40-10 positive current, the pain fibromyalgia, cervical trauma protocol has 40-10 in it, and you would run these for 90 minutes, 1 to 3 times a week. More, I think 1 time a week would be sufficient. If you suffer from chronic pain, you're going to experience progressive relief by running this frequency pair, and then in the background, perhaps not detectable, your inflammatory cytokines within your body, the hallmarks of inflammaging, are also going to drop. Thanks for listening. If you have any questions, please email me at drmittag@drharlanmittag.org. Thanks a lot. Bye.